Hello, my name is Carlos Treichel. I'm a master's degree student at Federal University of Pelotas in Brazil. And today I'm here to present my paper, Overweight and Obesity Among People with Mental Disorders in South of Brazil. In the last years, overweight and obesity became a relevant issue in public health. Especially in people with mental disorders. Some factors like the lack of physical activities, unhealthy diet, obesogenic effect of medication can intensify the problem. Since the approach of overweight and obesity is recent on this population and only a few studies were published in this topic, especially in Brazil, this paper aims to identify the prevalence of overweight and obesity among users of community mental health services in south of Brazil. Our first hypothesis was that overweight and obesity is more frequent on people with mental disorders than in general population. To this research, we developed a cross-sectional study which clips an evaluation research held during the year 2011 on community mental health services from south of Brazil, named Capsule 2, and has a representative sample of community mental health services users which correspond 1,267 persons. In order to track the occurrence of overweight and obesity, the participants had their body mass index calculated. This is our results. This study found out a prevalence of overweight and obesity respectively 34.8% and 21%. Considering as reference for categorizing body mass index, it was used Brazilian Guidelines of Obesity 2009, which suggests that in this study, participants presenting a lower prevalence of overweight but a higher prevalence of obesity compared to general population in Brazil. However, we have some limitations, and some of them is the lack of user data in previous conditions, time of diagnosis, and medication. But even with this limitation, considering the real risks of obesity, there is important that mental health services establish actions in tackling obesity among people with mental disorders. And even with the limitations, we believe that this study can become an important tool for developing more effective and real propositions and encourage new studies about this topic, especially in Brazil. Thank you for your attention and see you soon.